I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Dizziness and vertigo are both common and complicated. They can be hard to diagnose and challenging to cure. This is the People's Pharmacy with Terry and Joe Graydon.
One of the lingering complications of long COVID has been postural orthostatic tachycardia syndrome, known as POTS. People often feel lightheaded or dizzy when they stand up.
Many other conditions can also upset your balance. Low blood pressure, many different medications, ear infections, or migraines can all trigger vertigo.
How can doctors accurately differentiate between these and many other possible causes of balance problems? Our guest will answer your questions.
Coming up on the People's Pharmacy, overcoming vertigo and dizziness.
In the People's Pharmacy Health Headlines, drugs used for diabetes and weight loss seem to have other benefits as well. The GLP-1 agonists like semaglutide have shown some promise against addictions like alcohol use disorder, as well as cardiovascular benefits. Now, a study in JAMA Neurology suggests that people taking drugs like Ozempic or Wegovy may reduce their risk of developing Alzheimer's disease or similar dementias. Other diabetes drugs like empagliflozin or Jardiance or dapagliflozin, Farxiga, appear to offer protection as well. Researchers analyzed health records of Floridians over 50 between 2014 and 2023. The relative risk reduction was impressive, calculated at 33 to 43%. The absolute risk reduction, as usual, is less dramatic. 2.26 fewer individuals on semaglutide developed dementia over 1,000 person years. The rate for the flozins was about 3 fewer per 1,000 person years. Rather than placebo, other diabetes drugs provided the comparison. The authors note that these findings might encourage doctors to consider one of these medications for people with type 2 diabetes concerned about dementia.
Obesity remains a major health problem in the United States. Researchers have been arguing about the effectiveness of intermittent fasting for years. A new study published in the Annals of Internal Medicine compared daily caloric restriction to intermittent fasting. Those in the intermittent fasting group were told to cut their energy intake by 80% on 3 days of the week. On the other 4 days, they could eat normally. The people in the calorie restriction group were told to eat 1/3 fewer calories than usual every day. Those in the intermittent fasting group lost almost 8% of their body weight over the year. In comparison, calorie restriction resulted in a 5% weight loss over the same period of time. Both groups were offered behavioral support and encouraged to engage in moderate intensity physical activity. Although the difference in weight loss was not large, it suggests that some people could find intermittent fasting a more feasible way to lose weight and keep it off.
Colon cancer is an important cause of death, so it comes as no surprise that people diagnosed with colon cancer have shorter survival times than those in the general population. Cancer patients can reduce the discrepancy, though. A study of almost 3,000 people with stage 3 colon cancer found that physical activity lowered their chance of tumor recurrence in the first year. The researchers analyzed data from 2 chemotherapy trials in which patients had answered questions about their physical activity at 2 different times during the trial. Median time for follow-up was about 6 years. Individuals who engaged in more physical activity were more likely to survive. This was especially noticeable for those who reported 18 or more med hours a week and who had no recurrence by the 3rd year. The authors note, maximizing how patients feel, function, and survive is critical to cancer survivorship and control. They suggest that physical activity is a cornerstone to optimizing colon cancer survivorship.
Nutrition scientists have long assumed that people consuming unprocessed foods get more nutrients. Now a controlled trial has tested that assumption. The volunteers consumed 4 foods at different times: raw Elliott blueberries, raw Olympia blueberries, a protein bar made with Elliott blueberries, and a shake with the same macronutrients as the protein bar, but without blueberries. The Elliott and Olympia blueberries have different polyphenol profiles and concentrations. While there were some discrepancies in the concentrations of various polyphenols after these different foods were consumed, overall they were minor. The researchers conclude polyphenol-dense foods, such as bars and snacks, could provide similar health benefits as raw fruits. They do recommend further studies on other crops. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Terry Graydon. I'm a medical anthropologist.
And I'm Joe Graydon. I'm a pharmacologist.
Today on the People's Pharmacy, we'll find out why you feel dizzy. Even more important, we'll discuss what you can do about it.
Dizziness can be, incredibly disorienting. It's hard to function when you feel off balance. Do you have a story to share or a question for one of the country's leading experts on balance disorders?
We invite you to join the conversation at 888-472-3366. You can also email us your questions and share your story at radio@peoplespharmacy.com. Again, call with your questions, 888-472-3366.
Today, we are honored to welcome Dr. David Kaylie back to the People's Pharmacy. He is professor and vice chairman for clinical operations in the Department of Head and Neck Surgery and Communication Sciences at Duke Health. Dr. Kaylie is a neuro-otologist who manages a wide range of disorders of the ear, hearing, and balance. He is particularly interested in the impact balance disorders have on patients' perceptions of their well-being and interactions with the world. Welcome back to the People's Pharmacy, Dr. Kaylie.
Wonderful to be here. Thank you guys for having me again.
Dr. Kaylie, how common are balance problems?
It's really one of the most common disorders we see in the U.S. There's approximately 62 million visits a year to primary care, emergency rooms, ENT doctors for primary complaint of dizziness or balance disorder. So very common.
What kinds of things are causing all those balance problems?
Well, there's so many of them, and that's what makes it so tricky is that balance disorders can manifest in many different ways. It could be disequilibrium or vertigo or lightheadedness or passing out sensation. So any one of those systems can be caused by the heart, the brain, the inner ear.
It has always seemed to me that your specialty faces a particular challenge because, if somebody goes into the dermatologist and says, well, I've got this rash. Well, you just look at it, and the dermatologist goes, oh, yeah, that's hives.
Yeah.
Or you got poison ivy.
Or, they may need to take a sample, but yeah.
Right. But dermatologists have the benefit of being able to look.
Yeah.
And if the cardiologist gets a patient who says, oh, I've got chest pain, it's crushing, you can take a blood test. You can see, what the troponin levels are. You can do a CT scan.
Image, yeah.
Yeah, and you say, oh, yeah, you're having a heart attack. If somebody comes into your office and says, I feel dizzy, it's not so obvious.
No, that's one of the biggest problems that doctors and patients face with dizziness is, first of all, people look normal. And so they come in dizzy and everyone says, well, you look fine. And
that's not very helpful.
That's not very helpful at all, and it just leads to anxiety and a feeling that there's something wrong with them. And we do have very little laboratory tests or X-rays. We have some tests that can confirm certain disorders, but there really is no diagnostic test for dizziness other than what the doctor can elucidate from the patient, the patient says their symptoms are.
Do you have dizziness? Have you ever experienced that very uncomfortable feeling of the world not quite right? Give us a call. Dr. Kaylie is standing by to answer your questions. 888-472-3366 is the number to call. And you can email us, radio@peoplespharmacy.com. Again, that phone number, if you've ever experienced dizziness or have had trouble with symptoms of just feeling not quite right about the world, well, there are lots of reasons for that, but especially if the world just seems to be rocking around on you, it's 888-472-3366.
Let's talk to Karen in Van Eaton, New York. Karen, welcome to the People's Pharmacy. Tell us about your situation.
Hi there. Yes, I have been dealing with Meniere's for approximately 10 to 12 years. Right now I'm stable, but it's been debilitating when I during that time there was a period when I was trying to figure out what was going on. There are two different periods where for over a year I was just extremely ill with the vertigo, vomiting, and I have terrible tinnitus. And I've discovered that mine seems to be linked to allergies. I never had allergies before my first episode, and then I had really bad allergies, and then everything started. And through my research, I discovered that they say approximately 30% of the people with Meniere's allergies are a trigger. Anyway, I am getting allergy shots now, and I have an air purifier for the house. I wear a mask outside when I mow and, during the worst seasons. But I'm calling, it's really refreshing to hear this conversation, so thank you for having it. But I'm calling, wondering if there's anything new that can help with any of these symptoms. I'm hoping so.
Dr. Kaylie.
Yeah, definitely. Hi, Karen. Thank you for calling, and I'm sorry you're suffering from Meniere's because it truly is an awful condition. And allergies clearly have some component to it for some people. That's why spring and fall are particularly bad for most Meniere's sufferers. It could be from allergies. It could also be from rapid changes in temperature and barometric pressure, which we see in the spring and the fall. So understanding that is very important to getting people treatment and allergy treatment, but there are lots of medications also.
What is Meniere's disease?
So Meniere's disease is diagnosed by 4 symptoms, and there is no lab test or x-ray for it. It's just these 4 symptoms, and it's episodes of vertigo, which is truly a rotational spinning sensation that lasts, 15 to 20 minutes to hours. Could last up, a whole day. And it's associated with sensation of intense pressure in the ear. A lot of people say it feels full or they have to pop their ears but can't. Their hearing drops and they get very loud tinnitus, which is noise in the ear. A lot of times it's described as a jet engine or a roaring noise. And so when people have all 4 of those symptoms simultaneously, that is the diagnosis of Meniere's disease.
And what are the standard treatments?
So a lot of new treatments are out there and a lot of standard treatments. In the U.S., one of the most common treatments is a medication called diazide, which is a diuretic. It lowers your body fluid. But and in the rest of the world, the most common treatment is a medication called beta-histine. In the U.S., it's not commercially available.
Whoa. Why not?
Well, it's what's called an orphan drug. It became generic before any FDA trials were done on it, and so it's not worth the hundreds of millions of dollars it'll take for it.
Can people import it from, Canada?
Well, yes. It's called Circ or Beta-Circ. And
So I'm going to ask you to spell that.
SERC, Circ, or Beta-Circ, BETASERC. However, it is available as a compound medication in the U.S.
Uh-huh.
And so that is how I prescribe it. And it turns out it's the most commonly prescribed medication. It's a first-line treatment for Meniere's disease, and I find it to be far more effective than Diazide. Also, diet modifications. Some people are very, very sensitive to salt, which makes you hold on to more fluid in your body, which for various reasons can make you retain fluid in the inner ear, which is thought to be the underlying mechanism. However, many people are not sensitive to salt. But so as medications go, Diazide and beta histine are really the most common.
And do they work pretty well?
Yeah, 80% of people with Meniere's disease can be controlled medically with just diet modification, allergy management, and one of those or both of those medications.
And is this drug that has to be brought into the country affordable?
Yeah, so I don't know what it is what it costs when people buy it from Canadian pharmacies, and I don't have any way of recommending that. But as a compounded medication, it's fairly inexpensive. Generally about $50 a month in that range. However, compounded medications are not covered by any insurance, so that does have to be made clear.
Out of pocket.
They're
Well,
out of
it
pocket.
seems rather a shame that there isn't a manufacturer who has been willing to take it through the clinical trials, but we do recognize that can be very expensive.
Yeah.
Thank goodness it can be created by a compounding pharmacist.
Exactly.
We have an email. Can I read? Do I have time
You
to
have
read an email?
1 minute.
All right. This email is from Lou, who says, I've been having a problem with this for around 10 years. Each year, my symptoms, spinning, nausea, diarrhea, feeling hot, followed by coldness when the episode is over, became more frequent and more debilitating. It feels like I'm falling, like the bottom just dropped out. Symptoms tend to occur in the morning but could happen any time. They also tend to be seasonal, late winter through spring being the worst time. They could be brief, just an instantaneous drop, or last an hour or more. I was diagnosed with Meniere's disease 2 years ago, but restricting salt made no discernible difference. The Epley maneuver did not help. Due to seasonality, I've come to believe allergies are a trigger. Is this possible?
Well, yeah, like I said, allergies probably do play a component in it. Depending on what part of the country you live in, here in North Carolina, we can have 80 degrees one day and 40 degrees the next, and barometric changes, and the inner ear is very, very sensitive to changes in barometric pressure, so that may have something to do with it as well. So clearly, allergy management is very important. Just if it does nothing for the dizziness, at least it controls your allergies, which are pretty miserable also.
We are talking dizziness today on the People's Pharmacy. Our guest is Dr. David Kaylie. He's Professor and Vice Chairman for Clinical Operations in the Department of Head and Neck Surgery and Communication Science at Duke Health.
After the break, we will explore the differences between vertigo and lightheadedness.
Are you feeling dizzy because of an inner ear problem? Or might it be neurological? Our lines are open. 888-472-3366. If you can't get through, email us. radio@peoplespharmacy.com.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This podcast is brought to you in part by Caraway and its line of fabulous kitchen products. If you're making a conscious decision to make healthier choices, the tools you use for cooking are important, just like the food you choose.
For years, we've been avoiding Teflon and other PFAS-based nonstick cookware. We were excited when Caraway asked us to try their products because of their commitment to safe kitchenware, free from harmful chemicals. Their pots and pans use no PFAS, no PFOA, no PTFE, and no heavy metals. Instead, they have a non-toxic ceramic coating that's lovely to look at and a dream to cook with. Cleanup is a breeze.
The Caraway cookware set comes in 8 eye-catching colors. We like the cream, but you might prefer navy or marigold, or you might choose your mom's favorite color. They would make an elegant Mother's Day present.
Spring into action with the Healthy Swap to Caraway. Our favorite cookware set will save you $150 versus buying the items individually. Plus, if you visit carawayhome.com/PPOD, you can take an additional 10% off your next purchase. This deal is exclusive for our listeners, so visit carawayhome.com/PPOD or use code PPOD at checkout. Caraway, non-toxic cookware made modern. Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. Today we're talking about why you feel dizzy and what you can do about it. Our guest is the dizziness doctor, Dr. David Kaylie. He is professor and vice chairman for clinical operations in the Department of Head and Neck Surgery and Communication Sciences at Duke Health.
And we'd like to hear your story. Our lines are open for your experience and your questions about vertigo and dizziness. Our number is 888-472-3366, or you can email us radio@peoplespharmacy.com. That number again, 888-472-3366.
Dr. Kaylie, would you tell us a little bit about your new diagnosis project, Dizziness as Paradigm, and why it's so hard for dizzy patients to make their needs clear to doctors, and how doctors may not always give dizzy patients the respect they deserve?
Yeah, there's a lot of reasons for that. The experience of dizziness is very unusual, and it's not part of our daily experience. If you have a headache and you tell the doctor I have a headache, we all know what that means. We've all experienced that. But the experience of dizziness is not something we all know, and to try and put that into words could be very, very difficult, and it could be very difficult for the doctor to understand it if the words are to explain it are not really accurate. And so it's very difficult for a patient to put a lot of the symptoms into words and that the doctor can understand. There's also a lot of communication problems with the doctor who may not appreciate it and may not give the patient the respect and that they deserve for having symptoms that they may not fully understand.
Well, tell us a little bit about how dizziness affects somebody's quality of life.
Well, balance is what makes us human. Everything we do in our lives requires balance. Even just sitting upright requires the balance system to work. But the balance system is in the background. It's not something we have to think about. It's automatic. But it affects every single aspect of our lives and communication. So when balance is disrupted, it really impacts what it means for us to be human. And so it's extremely anxiety provoking, because when you don't have good balance, when you have disequilibrium, you can't interact with the world. The world loses significance for you because you can't interact with it in a way that is meaningful for you.
Let's go to the phones and talk to Denny in Raleigh. Our number is 888-472-3366. Denny, welcome to the People's Pharmacy.
Hello. Thank you for taking my call. I've enjoyed your show for years.
Thank you. What's on your mind?
So I've got floating vertigo. It's like stepping onto a moving dock or stepping off of a moving boat onto a solid surface that feels like it's moving. And after multiple testing and stuff, or after a couple of years of trying to figure it out, it turns out it's a pinched nerve in my spine, the C5, C6. And according to something on the NIH, it was called, what can be, I'm a retired architect, and I spent decades been over a drafting table. And now that I'm 73, I've lost several inches of height, and that's pinching the nerve. And I'm resolving it right now through PT. I went to several PT sessions, strengthening the muscles along the spine, and I'm inverting. I've got an inversion table. I do that like 15 minutes a day. That helps. And I just want to let the people that people who are in certain positions because of their occupations over the years, like all the time. There seems to be something that can happen to them. My next thought is I might try acupuncture or dry needling. I was wondering if that could possibly be a next step for me.
Dr. Kaylie, any thoughts about what Denny is going through?
Yeah, certainly certain occupations are a risk, and ergonomics are very important. Surgeons particularly have a lot of spine issues, myself included.
Because
And
they're bending
because they're
over?
bending over,
Oh.
yeah, in bad positions. I myself have had 2 spine surgeries, so I know what you're going through. Um, there is not a direct correlation with a pinched nerve in the neck and vertigo. However, bad posture, bad body positioning is can lead to balance disorders, and particularly sensation of disequilibrium, because the balance system is not just your inner ear, it's your proprioception, your body position, the sense that the muscles in your body and the joints and receptors tell your brain where your body is in space. So if that's altered because of a pinched nerve, which is causing altered sensation, it could change your body posture, which can then give you a sensation of disequilibrium.
Any thoughts about acupuncture or dry needling? Do we know anything about that?
It's not in my wheelhouse. However, I
Okay.
don't think that something that's been around for 5,000 years would still be around if it did not have some benefit. I've seen wonderful things happen with acupuncture.
I've got an email from Gary in Wilmington, North Carolina. He says, I experienced an acute response to COVID nearly 3 years ago and have struggled with balance issues ever since. Any suggestions?
Yeah, that is definitely something we're seeing these days. It's not common, but when something happens to 300 million people, there's going to be all kinds of ramifications from that. And balance issues certainly are things that we're seeing. I see it fairly commonly. There's really, we would need to learn more about what the specific symptoms
It
are.
sounds like that virus has done something bad to the either inner ear or to the brain.
Yeah, we don't know. The patients that I've seen with long COVID balance systems, when we do testing of the inner ear, the actual function of the inner ear seems to be okay. It very well may be something central. By central, we mean in the brain, in the central nervous system. But what that is very difficult to tease out. We just don't have great testing for it.
I've got Michael in Richmond, Virginia, with an email. I get vertigo after lap swimming. What's the best way to dry out the inner ear? I wear earplugs, but I still get inner ear fluid. Any thoughts about vertigo after swimming? And, a lot of people like to breathe just from one side. Terry has taught me to breathe both sides, and that has helped me avoid some of these problems.
Yeah, so there's a misconception there. The inner ear is behind the eardrum. So if you have an intact eardrum, you can't get fluid into the middle ear, let alone the inner ear. So that is absolutely not an inner ear problem. Now, you may get fluid in the ear canal, and cold water in the ear canal can cause dizziness. We see that in scuba divers, where if you get more cold water in one ear than the other, that mismatch will cause vertigo. So good earplugs is a good way to do that. Warmer water is fine too.
We have an email from Peggy in Durham. She says, I'm wondering why I sometimes, but not always, continue to feel motion like rocking after I stop an activity. She was trying to balance on a ball, and when she got off, she felt the wobbly rocking as if she were still on it.
Yeah, that's not uncommon for people to have a brief episode of continued sensation after something like that. People who go on a cruise for maybe an hour or so after they get off the boat, they might have to get their land legs back. But it's probably a compensation mechanism within the balance system in the brain for while you're in that position to try and maintain balance, and the brain just has to reset after you get off, but it's usually very self-limited.
We have a question from Betsy who says, I have a friend who was cured of vertigo, by a therapist who knew how to do the Epley maneuver. How does that work? And I have had this problem. It's called BPPV, benign paroxysmal positional vertigo.
It's one of those medical uses of the word benign. In ordinary English, benign means something good. In medical terminology, it just means it's not the worst thing it could be, right?
Yeah, we generally, that's probably a good way to put it, yeah.
But it's not benign. I can tell you, when you have it, it makes you feel very uncomfortable.
So what is BPPV? What causes it, and what's the Epley maneuver?
Yeah, so BPPV is probably the most common cause of dizziness. Unfortunately, it's the most easy to fix. It's caused by crystals in the inner ear that are supposed to be in one position, floating into another area of the inner ear. And the Epley maneuver is a maneuver that rotates the body and the head through 360 degrees, which helps the crystals get out of this part of the inner ear that's shaped like a semicircle, a half circle. And the crystals are in one end of the circle, and the Epley maneuver moves it all the way around to the other end of the circle, where it falls out and becomes gone, and the symptoms improve.
Now, can you do this yourself? Because there are lots of YouTube videos, and yet there are people who can actually do this for you. Who would you go to see to do the Epley maneuver?
And any ENT doctor can do it. A physical therapist is very common, but it really is something you could do at home. You cannot make things worse. You can't damage anything. You can't cause any problems. If you do it wrong, it just won't work, but you're not going to make it better. But there are very good YouTube videos on how to do it. It's fairly simple.
Yeah, it is. We have actually done it for Joe. He likes to have somebody guiding him through it, so I take on that position.
You do need someone to guide you and time it.
Yeah.
And Epley is spelled Epley.
Correct. It's named after John Epley, who was an ENT doctor in Portland, Oregon, where I did my residency, so I did meet him, and yeah.
Oh, that's cool.
Yeah, interesting guy.
We welcome your calls, your questions, and your experiences. Give us a call at 888-472-3366. If our lines are full, email us. Our email is radio@peoplespharmacy.com.
And we go to Stewart's Draft, Virginia. Chadwick, welcome to the People's Pharmacy.
Hi, good morning. Thank you, Joe, Terry, and was it Dr. Kaylie?
That's
Dr.
it.
Kaylie.
Kaylie.
So my question concerns, I'm getting dizziness, and I work in a warehouse, and so lately, after doing some work, I've been hearing my own voice in my head and my own breathing, and after a while, I get disoriented to the point where it's hard for me to talk in sentences, and the only thing that makes me feel better is lying down. It's always accompanied with a lot of sniffing and a lot of cracking in my ear and popping. It's almost like someone, shut off a gun. That's how confused I am. It's very concussive feeling. I definitely feel very out of it. And I went to a doctor, and he didn't really know much about it, and just gave me a referral to an ENT. He mentioned something about my eustachian tube might be the issue, and prescribed me Sudafed and saline, and it's not really working.
Yeah, that's actually a pretty common symptom, something we're learning a lot more about. It may be eustachian tube dysfunction, but that generally does not cause those types of symptoms. One thing that comes to mind, which certainly you would need further investigation by an ENT doctor, is superior semicircular canal dehiscence syndrome, SSCD.
Let's definitely talk a little bit more about that, because we have had a friend who has been suffering with this. She did have surgery for it, which helped a little.
So tell us that very complicated medical term again, and what would be the symptoms?
Yeah, so SSCD is probably the easiest way to think of it, is a condition where there is an abnormal opening in one of the canals, one of the semicircular canals I was talking about, and it opens up into the brain cavity, and pressure from within the brain can be transmitted into the inner ear. And it has very characteristic symptoms where you hear your own voice and your own breathing very loudly in one ear. People often complain that they hear their heartbeat very loudly, and exertion or loud noises can bring about severe disequilibrium.
One person said she could hear her eyes move.
Absolutely. That's a really common thing, which is very strange. And people find it weird when I ask that, but that's because when the eye moves, it sets up a wave of spinal fluid, which that pressure can then be transmitted to the inner ear.
So, Chadwick, it sounds like you need to ask the person you've been referred to check you out for that.
What can be done about it?
Well, it really depends on how much it bothers you, because it's not dangerous. It's not going to make you go deaf, but it could be very, very disruptive, particularly the balance part. And hearing your own voice could be so disconcerting that people just don't want to talk. And
that's what Chadwick said. Yeah.
Yeah. So that's again it's very disruptive of your life. There is a very, very good surgeries for it, which have really high success rate. So there is nothing else but a surgery for that.
So
Okay.
Chadwick is gone. I was going to say, Chadwick, it sounds like there may be a solution to your problem. You need a good ENT who might be able to do that surgery. Terry, I've got an email from Virginia who says, my mom went to her primary care physician a number of times complaining of dizziness, and she had her blood pressure tested, and it was different between standing and lying down. There's like a 20-point
actually
drop
normal to
in
be
systolic
different.
blood pressure. We discovered that she had broken her femur. Oops, I'm trying to find the question. Now it's disappeared. So the question about blood pressure, and in particular when people have low blood pressure and stand up suddenly, and now they feel dizziness and they may fall over.
Right. So that's a condition called orthostatic hypotension, and it's something we've all experienced. I'm sure everyone's had the experience where you bend over gardening for a long time or tying your shoe and you stand up real quickly and you get a brief sensation of disequilibrium, almost like you're going to pass out. That's truly a lightheaded sensation. And
So that's different from vertigo, which is the spinning. Yes, I
Right.
have had that lightheaded sensation when I have been bending over in the garden.
pretty much everyone has had that at some point.
What
Yeah.
can you do about it?
Well,
Do you need to do anything about it if you don't actually pass out?
Well, yeah, it could be disruptive in your life if that happens very frequently. You should have your blood pressure checked. Sometimes we see it in people who are on a lot of blood pressure medicines, and maybe they're on too much, and so their blood pressure is too low. So that needs to be checked. Other times it just happens as you get older, you lose the ability to compensate from changes in posture quick enough. So we recommend people get up slowly, maybe sit on the side of the bed for a minute before they get up. Instead of jumping right out of bed, just go from lying to sitting and then sitting to standing very slowly.
We are talking today with Dr. David Kaylie. He is professor and vice chairman for clinical operations in the Department of Head and Neck Surgery and Communication Sciences at Duke Health. It is time for us to take a short break. And when we resume after that short break, we'll take more of your questions about why you feel dizzy. What type of doctor is most helpful?
Our lines are open for your questions and stories at 888-472-3366. If our lines are full, you can email us radio@peoplespharmacy.com.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Today, our topic is why you feel dizzy and what you can do about it. Our guest answering your questions is Dr. David Kaylie, professor and vice chairman for clinical operations in the Department of Head and Neck Surgery and Communication Sciences at Duke Health. Dr. Kaylie is a neuro-otologist who manages a wide range of disorders of the ear, hearing, and balance.
You can join the conversation by calling 888-472-3366. You can also email us. That email address is radio@peoplespharmacy.com.
Let's talk to Ann in Addison, Texas. Ann, welcome to the People's Pharmacy.
Hi. Well, my situation was that I was falling in the fall, but anyway, I'd fallen a couple times, and I talked to a friend, and she said, try walking backwards. So I try to walk every day, and I do this because I thought it was a little strange. I do it just for a few minutes, maybe 5 minutes, and walk backwards, keep turning your head from left to right, and I haven't fallen since then. So I don't know if it was just that my body corrected itself or that this actually worked.
It sounds a little bit like magic, doesn't it, Ann?
It was great because I had fallen in the bathtub or a shower, I should say, one time. That scared me.
Yes.
No kidding. Dr. Kaylie, walking backwards?
Well, and I think what you figured out is one of the main tenets of balance therapy. It's called habituation therapy, where you put yourself in positions that stress the balance system, and it retrains the brain to use the input it's getting more effectively. So by walking backwards or moving your head side to side while you're walking actually is one of the things we do in physical therapy or what's called vestibular rehabilitation therapy. And by doing that, you're teaching your brain how to use your proprioception, your body positioning, and your vision system more effectively. And it really is the treatment for balance disorder, for a lot of balance disorders, is physical therapy.
Thanks for that call, Ann. We appreciate it.
Now, we have an email from Kim who sounds like she may have the very same thing we talked about a little earlier. Would Dr. Kaylie be able to tell me what might cause someone to hear their pulse in their ear? 64, in good health. When I bend over, I hear my pulse in my lower ear. When searching Dr. Google, superior canal dehiscence syndrome seems to potentially match my symptoms. Any advice or experience? And it sounds like if that's what she has, and of course we cannot diagnose over the radio, she might want to see a otolaryngologist?
An otolaryngologist.
Who might need to do surgery if that's what she has.
Oh, that's way down the line.
Down the road.
Only if it's really disrupting her life.
There
right?
are far more common reasons why people have pulsation in their ear, particularly as you get older. You have very large blood vessels that drain from your brain that go behind the ear that become your jugular vein in your neck. And as you get older, those vessels can become stiffer, and so they don't expand as well. So when the blood is pulsing through those veins, it can cause noise. It's turbulence in flow. Just like when you put your finger over a garden hose, it comes out faster and makes a hissing noise. That's turbulent flow. So that is really much, much more common than superior canal dehiscence.
Well, this does demonstrate one of the dangers of Dr. Google.
Yeah.
Because you might think, all these symptoms line up with this very weird situation, but in point of fact, you really do need to go in and see the expert. And again, tell us, for people who have been suffering from dizziness or vertigo, and by the way, what is the difference between them? What kind of doctor should they be seeing?
Yeah, so dizziness is a really vague term. It can mean anything, and we really don't. One of the main things that a doctor has to do is differentiate what the symptoms are. And vertigo is generally considered a true rotatory spinning sensation, but it's also an abnormal sensation of motion to a normal movement, or an abnormal sensation of motion even if there is no movement. So it's really important to have that differentiation. What is you're perceiving, and really understand vertigo is a true sensation of abnormal motion, where dizziness could be anything from lightheadedness from standing up too quickly, having too much to drink, being dehydrated, being tired, medications, all those things. So it's really the most important thing for a doctor to do when talking to a patient who comes in with dizziness is differentiate what the sensation is.
What symptoms should send a person to the ER or, urgent care, but probably even the ER?
Well, dizziness, uncontrolled vertigo sensation, particularly if it has other symptoms like numbness or weakness in the body, vision loss. Those are all signs of a stroke, and that could certainly requires attention immediately. Yeah.
So let's run through that one more time. If somebody's feeling really dizzy all of a sudden, and there are other symptoms that are along with it,
Absolutely, yeah.
right to the emergency department.
Yeah, so slurred speech, or you're just cognitively impaired, or numbness on one side of your body, or weakness on one side of your body. Yeah, that's an emergency.
Now, we have talked to a physician at Hopkins who has developed a way of trying to determine if someone is actually having a stroke because of dizziness. Their eyes start wiggling or waggling, called nystagmus.
And there is, he's got a way of determining this, but he's also developed a sort of goggle that you can put on the patient that will be able to pick it up. Have you heard of this?
Well, nystagmus is a very, very common sign of vertigo, and it's not necessarily a sign of a stroke.
Right. No, there's a different eye movement that he's working on.
Right. And there are goggles that are very commonly used that are infrared goggles, because when you take away light, it can unmask nystagmus that's suppressed with vision.
Let's go to Stanton, Virginia. Karen, welcome to the People's Pharmacy.
Hi. My problem is that whenever I turn off the electric lights when I'm going to bed, I lose all sense of my balance. I fall over against the furniture or the wall, and I have no sense of grounding. I feel kind of like an astronaut.
Yeah, that's not uncommon. The important thing to know is the balance system is not just your inner ear. It's the brain gets input from vision, from your muscle sense, and from your inner ear. And when all three line up, you have good balance. So if you have a weakness in one of those systems, like let's say you have a inner ear balance problem, you may not notice it when there's light because your brain is compensating by taking visual input. But when you take away the visual input in the dark, it can unmask an underlying inner ear disorder. So that's very common for people's balance to get worse in the dark if they have a undiagnosed inner ear disorder. So that would be something that can be tested by a ENT doctor.
So, Karen, it sounds like you need to see the doctor about that one.
I've got an email, and this person says, I had an operation in... where did it go? There it is. An operation in Canada. After the operation, they told everyone in the hospital not to stand suddenly when they get up from the bed. One man did that, and he fell. Must have had 25 stitches in his face. Did they tell us not to stand up suddenly because of side effects of the anesthesia or for another reason?
Well, I think anybody who's had general anesthesia can be a little groggy and disoriented. And if you stand up too quickly, it's So anybody after surgery should not get up out of bed without assistance of the nurse. That's pretty common.
All right. Well, let's go to Grand Prairie, Texas. Hal, what's on your mind?
Hi there. I have a problem with a sudden dizziness that comes on me. It's very bad, and sometimes it's mild. and sometimes it's so bad that I just cannot stand up. I cannot sit down. The only thing I can do is just get on the floor and wait for it to pass. It doesn't last long, but I am a heart patient, and I just wondered, do you think it could be the medication that I'm taking, or, that's, what do you say?
That's interesting. So, Dr. Kaylie, the medications he's on, or is it the heart condition itself?
I really couldn't say for sure. It depends on what the
Exactly.
medications
Yeah.
are and what the heart condition is. But generally, it's pretty rare for a medication to cause true rotation vertigo or heart conditions to cause something like that. It could be something else as well.
But there are, of course, a lot of blood pressure medications that cause what we have referred to already as orthostatic hypotension.
That lightheadedness.
Yeah, if you stand up too suddenly, because it changes the way the blood vessels squeeze the blood. What do you recommend when people do have orthostatic hypotension or that dizziness upon standing suddenly?
It's something that they really need to talk to their primary care doctor about, particularly if they're on multiple blood pressure medications. Sometimes those need to be adjusted. And there are some people who just have it as a sign of aging, or not a sign of aging, but as a condition of aging where the heart just can't compensate quick enough for change in posture. But
So it sounds as though Hal needs to discuss this with his doctor.
right, because they need to differentiate what could be medication or heart condition symptoms versus what could be an inner ear.
I have an email from Vicky, and Vicky says, I have had mild tinnitus on the left for about 10 years. The last 2 years, I have a very loud noise accompanied by bad vertigo for 2 to 3 hours. Can you help me understand about this relationship between tinnitus and vertigo? Are there any remedies besides low salt, which of course would suggest Meniere's disease?
Yeah, that those symptoms are within the realm of Meniere's disease. It would require a little further investigation, but if the tinnitus is accompanied also by hearing loss, that would really be a symptom of Meniere's disease.
And tell us about that medication that a compounding pharmacist can create.
Yeah, beta histine is really a wonderful drug for Meniere's. I use it as my first line because it really does not have side effects. It's truly easy to take. It's very, very rare. People can have some little GI disturbance, upset stomach, and anyone can have an abnormal reaction. But in general, it's extremely well tolerated. And it's very effective, and it doesn't interact with other medications. It's just really a great drug.
It's a shame it's not been approved here in this country yet, but it's available. And so most of your colleagues are familiar with this drug, I assume.
It's yes, I would say.
We have an email from Jana who says, my husband suffers from dizziness daily and has been told the ventricles in his brain are enlarged and he may need a shunt or brain surgery. We've explored the inner ear as the origin of his problem, so we were surprised to hear about brain ventricles. Can you tell us anything more about that?
Yeah, that's a condition called hydrocephalus where you have either too much production of spinal fluid or not well, you don't absorb it well enough, and so that increases pressure in the brain, and by doing that, it makes the ventricles, which are the spaces within the brain that are filled with spinal fluid, get bigger, and so that really is compressing the brain. And vertigo and headaches are really common symptoms of hydrocephalus. And a shunt medications, there's a lot of treatments for that.
Dr. Kaylie, if you had the opportunity to talk to your non-otolaryngologist colleagues, family practice docs, perhaps internists, what would you want them to know when it comes to dizziness and how to deal with it? Because not everybody can get to an otolaryngologist.
There's several things I would suggest. One is I think it's incumbent on everyone who treats patients to treat them as autonomous and respectful of their symptoms. And dizziness is a particularly disturbing symptom that's very poorly understood. So I think treating the patients with respect and understanding that they're going through something very, very disabling that really impacts their ability to be who they are, I think that's the first step. Secondly, I think it's really important for the doctor to be able to get the right symptoms from the patient. They need to really understand what the quality of the dizziness is. Don't just say, well, they're dizzy. You have to understand, is it imbalance? Is it rotation? Is it lightheadedness? Does it fluctuate? Is it there constantly? Does it come and go? Or does it have multiple symptoms and other symptoms that are associated with it, like headaches particularly?
We just have a minute left, but when people come to your laboratory, what do you put them through so you can better diagnose what's causing their dizziness?
The primary thing is talking to them and getting the symptoms. But we do have a battery of tests. They're called vestibular tests, which is a pretty comprehensive exam of the inner ear function. It's not perfect, and there's a lot that we just can't test. But those testing can be very helpful for a lot of people to really pinpoint where the problem is.
I understand you have a spinning chair that makes people feel very uncomfortable.
Well, not necessarily makes them feel uncomfortable. It's called a rotary chair, and it's an enclosed space where there's no light, and we watch eye movements as they go through rotations.
One of our emailers described it as torture.
There are certain dizzy conditions where doing that is actually torture. Particularly, people have what's called migraine-associated vertigo.
Yeah, I think that probably was what was going on with her. So that is all the time we have today. We ran out of time for you, Mindy. I'm sorry. But we want to thank everyone who called in, and especially we want to thank our guest, Dr. David Kaylie. He is professor and vice chairman for clinical operations in the Department of Head and Neck Surgery and Communication Sciences at Duke Health. Dr. Kaylie is a neuro-otologist who manages a wide range of disorders of the ear, hearing, and balance, and he's particularly interested in the impact balance disorders have on patients' perceptions of their well-being and interactions with the world.
The People's Pharmacy is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
Lynn Siegel produced today's show. Pamela Alberta and Ayasi Chinflu provided technical assistance. Al Wodarski engineered. The People's Pharmacy theme music is by B.J. Liederman.
Today's show is number 1426. You can find it online at peoplespharmacy.com. You can subscribe to our podcast through your favorite podcast provider. We post the show on our website on Monday morning. That's where you can share your thoughts about this show. We'd be ever so grateful if you wrote a review of the podcast. If you couldn't get through today to share your story, please email us radio@peoplespharmacy.com.
And if you go to peoplespharmacy.com, where you will find show notes for today's show, you could also sign up for our free online newsletter. It's an easy way to stay on top of breaking health news. By subscribing to the newsletter, you also get regular access to our weekly podcast and know ahead of time what topics we'll be covering.
And Terry, I suspect we can put into the show notes the name of that medication.
Yes, we can.
That Dr. Kaylie
We will do that.
recommended.
Beta-histine. We'll do that.
Beta-histine. So if you've been diagnosed with Meniere's disease, there is a solution. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.